Do you have low back pain? This video will teach you 3 easy to follow exercises that you can do at the comfort of your own home. Greetings to everyone, this is Dr. Cherry Bangoy, Doctor of Physical Therapy, and today I'm going to actually teach you 3 easy to follow exercises that can make you feel better. There are actually varied reasons why you may have low back pain. One of these reasons would include, but is not limited to, wrong posture, obesity, and osteoarthritis of the spine, among many others. This video would be very helpful because this will teach you about the concept of positional bias. Now, what does that mean? It means that certain positions of the spine, whether if it is flexed or extended, could either actually aggravate or reduce your symptoms. But before we proceed, there are certain red flag signs for as far as low back pain management is concerned, and these are the following. With red flag signs, it means that you do not progress with these exercises not unless you have yourself checked first by a medical healthcare professional. So these are individuals over 60 years old, those who have history of trauma, those who have personal or family history of cancer, for those individuals who have fever, those who did not feel any relief of symptoms even with taking painkillers, those who have difficulty urinating and defecating, and those who have experienced progressive or worsening weakness of both legs. Now, if you don't have any of those, so let's continue with our exercise. To check if you will have relief of symptoms with the spine flexed, I want you to stand and try to reach your toes. Hold this position for 5 seconds or so and try to observe if you are pain-free with this position. If you are, then do the 3 flexion exercises. So what I want you to do is to lie on your back. Then bend both knees together. This is exercise number 1, unilateral knee to chest. What you want to do is put both hands at the back of your knee joint and then try to stretch. Hold for 30 seconds and then slowly lower your legs. Then repeat 5 times. After doing so, repeat on the other leg. It's important that you put your hands below your knee joint because some patients who have osteoarthritis may feel pain. That is exercise number 1. The second exercise is bilateral knee to chest. So what you're going to do is you put both your hands beneath your 2 knee joint and then try to stretch. You hold it for 30 seconds and then after that you slowly lower both legs. You need to repeat this one 5 times. In the third exercise, you need a rolled towel or maybe a bed sheet. This is self-stretch for the hamstrings muscle. What you want to do is insert that cloth in your legs, lie down, and then slowly stretch. It is very important that the knee is extended. So maintain this one for 30 seconds and then slowly lower. Repeat 5 times. After doing so, transfer to the other leg. Hold for 30 seconds. Slowly lower and then repeat 5 times. So these flexion bias exercise are very important and very helpful for those cases who has osteoarthritis of the spine or otherwise known as spondylosis, those patients who have nerve root impingement, and those who have spondylolisthesis. The second is extension bias. So this means that exercises should promote spinal extension. To check if you will have relief of your symptoms with the spine extended, I want you to please stand and then slowly bend backwards as shown, and then try to hold for 5 seconds or so and try to observe if you are pain-free with this position. If you are, then do the 3 extension exercises. So for the first position, I want you to lie in your stomach with head tilted on one side. You hold this position for 3 minutes. Next, we do prone on elbows. You try to maintain this position for 2 minutes and then you can slowly progress to 3 to 4 minutes as tolerated. Now, at any point, if you feel any discomfort, you can always go back to the first position to rest before you proceed to the third position or to the third exercise. Lastly, we do prone with elbows extended. We need to maintain this position for 2 minutes and then slowly progress to 3 minutes as tolerated. You do these exercises continuously 2 times a day and you will really feel significant reduction or relief of your symptoms. These extension bias exercises are very helpful for cases such as disc herniation. If you find this video helpful, please like, subscribe, and share it with your friends or other family members who might benefit from this. Also, feel free to comment any medical conditions that I might be able to help you with. Bye!